Pada meeting kali ini, saat ini kita akan melanjutkan pembahasan minggu lalu yang mengenai makanan sehat yang berjudul Plant-Based Nutrition Throught Life Stage a Priority. Untuk mempersingkat waktu, dikarenakan sesi kali ini cukup menarik, kita langsung saja mendengarkan materi yang akan dibawakan oleh narasumber kita, Dr. Shenansi. Untuk waktu berikut, saya silakan kepada Dr. Shenansi.
So, good morning everyone. Once again, so I hope it's okay if I immediately converse or talk in English. I think I'm probably having some internet difficulty at the moment. So if any time, I think Chelsea here, if you sense or if you notice any lagging here on my end, you can message me anytime so that I can shift to mobile data for this presentation. Okay, so let me just open share the screen. Okay, so can everyone see the screen here? Yes, it's clear. Okay.
Yes.
So last week, I hope we all still remember what we learned last week, at least partially. We talked about the introduction to why plant-based diet matters. Largely, we talk about the importance of nutrition and the importance of nutrition for our gut microbiome and the importance of gut microbiome for our nutrition and for our health in general, overall, how significant it is and how there's so many research that has been going on for the past 2 decades on the gut microbiome, and it's still going to continue to improve. And there's just so much what we don't know yet at this moment about the gut microbiome, so much to discover, so much to uncover. And basically, the gut microbiome has been the target for the therapeutic target for illnesses. So this is going to be very interesting. And again, the good news is there's something that we can do, even though we're not healthcare professionals, even though we're just at home. There's something that we can do always with our lifestyle changes and what we're talking about here, the nutrition. And we talked about last time about the difference between the eubiosis and dysbiosis, if you remember, and then how what's the significance for our body. And we also talk about which nutrition matters, which plant-based nutrition and which plant-based nutrition, and we talk about the gold standard, which is the whole food plant-based diet, or probably the most commonly known these days is the vegan diet. What we want is the vegan that is rich in whole food and plant-based diet. And so I think that's quite enough to refresh our memory for last meeting. And so I'm going to continue. Okay, as usual, this presentation is intended for educational and informational purposes only, and it should not be construed as medical advice for a specific condition and not to replace medical advice offered by physicians. Now, I understand that last time, some of you have interest in, some of you ask about which plant-based nutrition is suitable or appropriate for conditions like GERD or gastritis, which we usually call it gastritis, like inflammation of the gastrointestinal lining. And for these illnesses, I'm actually very happy to talk about it. But the more I think about it, for your safety and for your wholeness, it is far better that you have a consult with a physician, of course, because the best diet that we know, we mentioned earlier, is the whole food plant-based diet. And for the gastritis and GERD, for example, it's still a whole food plant-based diet. And in I understand that we want to know, so which whole food plant-based diet which food should we increase and which food should we decrease. I think that's very understandable that each of us is asking that question. So, and for me, before we dive further into answering that question, I would personally ask, if it were me, I would ask myself, what kind of diet am I adopting? Is it a whole food plant-based diet already? And if not, can I do something about it? And have I avoided certain foods that are not part of the whole food plant-based diet? We can ask ourselves that question. And do I have any vitamin or mineral deficiencies? Do I have adequate proportion of nutrient intakes? Is it too much? Is it too much? Is it too little? Do I have enough vegetables? Have I taken enough fruits? Do I have enough fibers, the soluble fibers like psyllium husk? Like, have I avoided spicy foods causing irritants? And so there are multiple factors associated with the conditions like GERD and gastritis. So there are also cases of food intolerances, so there's always more than nutrition. And so what I'm talking about here is not just for improving symptoms, it's not just what you eat, but also everything you need to achieve wholeness. And in some cases, even if you have followed the best diet out there, but then your main trigger is, for example, stress or sedentary lifestyle or exposure to certain environmental agents, hygiene, or whatever that is, then we might be mistakenly disappointed with the lack of positive response to our body, despite having adopted whole food plant-based diet. So we first thing first, these are the GERD and then the gastritis. There are so many causes for this. It's not just dietary causes, so we need to prudently look into other lifestyle causes as well, or probably some intake of medications, some other factors that we need to look into. So getting the right diagnosis and correct the underlying cause is the main key here, in addition to adopting a whole food plant-based diet. And we need also to take into consideration like associated health condition, and so what kind of procedure that has been done before. Some of you, I am aware, but some of us may have done procedures like colonic irrigation and so on. So just to mention quickly, like things like colonic irrigation, enema procedure, that is actually not recommended in the medical practice nowadays by evidence-based medicine, and they can significantly alter our gut microbiome. So let's say you have GERD and you do this procedure, then after the post-procedure status post, which you would call it status post, or after the procedure has been done, even if, let's say, you took like probiotics, that you think might restore the gut microbiome, we're still dealing with a different species around here. We're not talking about the origin GERD itself, but we're talking about GERD plus colonic irrigation, which has reduced your gut microbiome alter significantly. Because when you do colonic irrigations, like you put water, significant amount of water to it, then you don't know which bacteria or which microorganism you're removing. Is it the healthy ones, the beneficial ones, or the not so beneficial ones? So procedures like this can significantly alter your gut microbiome and even lead you to acquire genetic diseases. So there are so many digestive diseases out there, and like I would say that for specific questions related to nutritional management for a specific disease, that would be better it would be better if we could like discuss it separately, like we could do separate talk specific on the disease itself, like for example, a lecture specific on GERD, lecture specific on gastritis, and that way we can have a more optimal discussion on how to identify most common risk factors and causes and how to achieve wholeness in a sense. Okay, so largely the thing that I'm discussing over here is largely personalized medicine, is basically personalized nutrition, and and largely preventive. So for today's health talk, it's largely preventive, not like for adults, older adults, for infants, toddlers. We're not talking about, let's say, preterm babies. We're talking more of the normal, because for preterm babies, you have a different set of nutritional strategies that you should be aware of, be mindful of, in order to improve the stability or improve the balance of your gut microbiome. So we're talking about here is more preventive. You have older adults in your house, then it may or might not be suitable for those with significant multiple comorbidities, but in general, we can always take an assumption that, or presumption that, yes, the whole food plant-based diet is suitable for all life stages. And of course, for more specific conditions, you're going to need, this is useful, this is beneficial, but for more specific illnesses, you need more than just this. You need more, a more precise prescription or advice that is tailored to your personal condition. So everything should be tailored to your personal condition. Okay, so we know that there are many groups of humans, many life stages that we have here. Before you're an infant, your mother is pregnant, and then when you're an infant, your mother is lactating, and then after infant, you go to be a toddler, and then teens, adults, and then older adults, and then the age of everyone dies. And today, I understand that Chelsea asked me to talk about the infants, the toddlers, and the older adult population. Initially, I was wondering why so extreme when we talk about adults and older adults, or this is very extreme. So, but then we'll try to get this through, and please bear with me because today's topic is a little bit long, but I hope I put a lot of pictures as well, and so I hope to keep your attention at bay. And so I hope, and then at the end of the session, there will still be another Q&A session, and so I hope this will still be beneficial for everyone that's here. Okay, so last time we talked about the eubiosis and dysbiosis, how important is the gut microbiome, how important is intake of fiber, and the significance for our health. Just a brief review. And then, so in early life, we know that the gut microbiome or the lifestyle factors is affecting the gut microbiome. There are so many things affecting the conditions before the pregnancy itself, not just the condition during pregnancy, but your mother's condition before the pregnancy, the mother's condition, I'm sorry. So I'm not aware if some of you are lactating, or some of you are pregnant at this moment, or some of you are thinking to get pregnant. So these things are significant factors. Even the mode of delivery, whether it's vaginal or C-section, that is also significant. That also has significant effects on the stability or the balance or the health of your gut microbiome. But right now we're just going to focus on nutrition itself, because for each of that factors, the topics are very broad, and then we probably don't have much time to go over one by one, but we're going to focus on nutrition specifically. So you can see here different kinds of bacteria and different stages of life, and how, again, it's just to repeat what I mentioned earlier. When you're a baby, things like whether you're breastfed or whether you're formula fed, that makes a difference. And then when someone is going through childhood stages, when he receives an antibiotic, or when he's having malnutrition, or whether that person's healthy, there's a significant difference in the gut microbiome. And then when you're an adult, when you're healthy or obese, there is always significant difference in the gut microbiome. So the gut microbiome is very, very interesting. Okay, and then this is, again, gut microbiome through life stages, at birth, in toddler years, early childhood. So you can see the difference, how the factors influencing the development of gut microbiota also influence the development of your immune and endocrine system, which is the hormonal system. And then if you have relatively a dysbiosis gut, then you are more prone to acquiring diseases like allergic diseases, irritable bowel disease, obesity, diabetes, and neurodegenerative diseases. So here, as I mentioned again, during pregnancy, during delivery, during infancy, there are many factors. Okay, So in early life, the early gut dysbiosis is associated with increased abundance of potential pathogenic microbiota, and then changes in bacteria composition and diversity can lead to disruption in the epithelial barrier and increase susceptibility to infections and immune disorders. Yes, so, but is it non-reversible? No. Some of them are reversible, some of them are non-reversible. So we're going to talk both sides here, and just to emphasize, malnutrition also can lead to microbial dysbiosis, which can increase the risk of inflammation and permeability in the gut. Okay. And this is just to show you that so many researches have been done on not just these diseases, but also other diseases, like for example, celiac disease, and you have there which bacteria is found to be abundant, the good or bad, found to be abundant or decreased when you have celiac disease. When you have rheumatoid arthritis, which bacteria is abundant, which bacteria is decreased. What happens in rheumatoid arthritis? There is microbial diversity. And how about multiple sclerosis? Same thing, there's microbial diversity, and certain bacteria, which we don't want, like Pseudomonas, are increased, and certain bacteria, like Prevotella, which we want to, which are good for us, are actually decreased. So we know all these things, like irritable bowel diseases. So the gut microbiome studies help us to have a knowledge into what is actually inside our gut, our intestine, and how are we going to improve our gut microbiome to make it more towards the eubiosis state. Okay, so in early life, there are many factors, once again, influencing the cognitive and microbiota development of the child. You can see here, as I mentioned earlier, preconception and pregnancy, okay, and then lactating, and then when you're a toddler, a lot of factors affecting. So for example, you have antibiotic exposure, then that would make changes. But can it be redeemed, or can it be improved by diet? Yes, it can. And then next here is the same thing. I've actually put a lot of pictures because I find that it will give us seeing pictures like this will give us a better understanding of how important the gut microbiome is for the life stages, especially in early life. And so here you can see, as I mentioned before, whether the baby is born through vaginal or cesarean section, it makes a difference. And then the question is, can it be improved by the diet despite the mode of delivery? Many studies say yes, but there are things that we still don't know yet. And of course, it is still better to have your baby born in vaginal delivery. So, okay. And many researchers have consensus that a child will achieve adult-like gut microbiota when the child is about 3 years of age, which is a toddler age. But then before that, during the infancy stage, these factors are very, very significant, and how the baby is being fed is very, very important. And we'll talk more about this after this. Okay, this is just to show it again. Cesarean delivery is associated with dysbiosis, junk food-based and gastric acid inhibition. Vaginal delivery here associated with eubiosis, the breastfeeding, high-fiber diet. So what happens during the pregnancy period, which we won't be discussing so much today, is very, very significant. But today we're going to be talking more into what happens during the infancy stage after the baby is born. Okay. Okay. In general, why again do we want plant-based nutrition for children? I'm going to mention here a few advantages, and I'm going to talk more about this in a research perspective later on. Basically, you have decreased risk for overweight and obesity if your children is following plant-based diet since infancy or since childhood, and the more fruits and vegetables and fewer sweets and salty snacks, and lower intakes of total and saturated fat, the better it is, and you are helping your child to develop healthful lifelong habits. Yes, habit. I cannot stress further more into this. Habit. It starts early. You start everything early. Start early. Because there's something, it's correlated with the gut-brain axis, which I will talk about later on. And actually learning about the gut microbiome for children is a good way for us to do some kind of reflection. For example, do we remember were we born with vaginal delivery or C-section, and how was our diet when we were little? We can all flash back and think about it, and it helps us to reflect on. It explains why I'm having this condition at this point of time in my life right now, for example. And some of you may be having obesity, overweight, and not all obesity and overweight are due to lifestyle factors. Some of them are very strongly correlated with genetics, but in most cases they are due to lifestyle factors, and we can use this knowledge to have a reflection for our own life, in addition to learning the benefits for our children. And so kids eating plant-based diets have also been shown to have either equal or higher adult IQ, not lower. Take note, either equal or higher, and that's very important. And of course, there are other factors contributing to IQ aside from the diet, but in here we were being told that the IQ is a significant contributor to, the diet is a significant contributor to our IQ. And then there are a multitude of cognitive benefits also, such as IQ, for kids consuming diet filled with unprocessed whole and plant foods. And then some factors, do we know that hardening of the arteries can begin as early as childhood, which stresses the importance of why plant-based diet matters as early as childhood as well. So obese children are likely to become obese adults. Like at age 6, the risk is 50%. If you're obese by age 6, then your risk of continuing or developing obesity in adult stage of life is about 50% higher. And for obese teens, the risk is as high as 80%. So this gives us some warning, some lesson before we actually achieve that age. And infants also, this is very important. Infants start developing taste preferences in the womb. So that, again, I explained to us, it matters what the mother eats when she is pregnant, or even before she's pregnant. It matters what kind of diet she's having. So that all matters. So, and for those of you who are contemplating to get pregnant, this might be a very good learning point to consider, because for the fact is we want the best for our children. Okay, so I'm going to go straight here. Plant-based nutrition for infants, the gold standard, I cannot emphasize further, is the breast milk. And many of you, I'm sure many of you are aware of this. And the WHO or the AAP is the American Academy of Pediatrics. And although this is from the US, take note that even the WHO or the many pediatric associations in the whole world is actually referring as well to the AAP. So from now on, I'm going to mention AAP quite often here. The recommendation is, again, exclusive for the first 6 months, exclusive breastfeeding, meaning just breastfeeding, nothing else, no food, nothing else, no other milk, exclusive. And if it's partial, it means that you do partial formula milk and partially you do breast milk. The gold standard is the exclusive breastfeeding, and not just for 6 months. 6 months is the golden period, but you can also continue for up to age 1 or 2 or even longer. It depends on the mother and the child. And for supplements, yes, some of you may or may not be aware, and we do give supplements for children, and then I will talk about it further after this. Vitamin D drop about 400 IU starting few days after birth until your child is ready to take foods that's fortified with vitamin D's, and also iron liquid supplement, about 1 milligram per kilogram per day, starting when they're 4 months old, and we'll talk more about this later. Okay, but you can see here, I don't mention anything about B12. That is because the recommendation is also for lactating mothers, because plant-based diet is appropriate for all life stages. Lactating mothers is advised to consume balanced whole food plant-based diet, and then also vitamin B12. We will talk more about the dosage later on, the dose, and also consume iodine, DHA, ALA, So these things for lactating mothers is very, very important to supply the nutrition for your infants, for your newborn, and vitamin D and all these things, calcium, iron, and zinc. Iodine is needed if you are consuming iodized salt, like Himalayan salt, that is non-iodized salt, so you're lacking iodine in that respect. So, but then still too much of iodine from iodized salt is also not good. So iodine-rich food, like from supplements, can also be of help. And I just want to stress here, for DHA supplements here, there are many sources, and yes, you can take the supplements, but not too much. 200 milligrams is the borderline here, because too much is not also good for the development of your baby's brain. And okay, so again, your baby will get enough B12 from the mother that is lactating. Okay, now why breast milk? Just in case, I'm sure many of us here are aware of the benefits of the breast milk, but in case some of us are not still convinced, or might have doubts, or not considering it as a priority, then we will see what AAP has to say about this. Exclusive breastfeeding for 6 months, your babies are going to be less likely overweight, and the duration also matters because it is inversely related with the risk of obesity. The longer your baby is breastfed, the lower the risk of obesity, and so also improve immune system. And then the long-term effect on weight control and feeding regulation is about 40% decrease of type 2 diabetes incidence. So there's a lot of benefits here. The challenge is, yes, benefits. Breastfeeding was harder than expected and may try but did not maintain. But as we go further into this lecture, you will, I hope you will be convinced why it has to be breastfeeding. It can't be anything else. Of course, I understand there are women out there who are contradicted for breastfeeding, like if they have certain contradictions, like certain viral illnesses, certain diseases. That's a different story. We're talking right now about mothers who are capable and not contradicted to have to do breastfeeding. Okay. This is one study here, one of the largest clinical studies on the infant microbiome. For 10 years, the study has been collecting samples from 6 clinical centers in Europe and the United States to determine what triggers type 1 diabetes in children at high genetic risk for the disease. So they collect the samples monthly when children are aged 3 to 48 months, and then every 3 months until age 10, and 6 months, every 6 months thereafter. So this is a large study. It's done for about 10 years, so it's a very credible study. And now, what did the study find? The study says that the first year of life is the key phase for the development of the microbiome, with the receipt of breast milk being the main factor. Take note, breast milk being the main factor that influences the gut microbiome development over this period. And they further divide the phases of the gut microbiome in early life as developmental phase, where bifidobacterium species dominated, transitional phase, and stable phase, which is about 3 years old and older, where the microbiome stabilizes like an adult gut microbiome. And there are other factors as well, like birth mode, as I mentioned earlier, geographic location, household siblings, and furry pets. This is also associated, but we're going to talk only about nutrition. And the study also says that the nature of mucosal microflora acquired in early infancy is proven to be critical to determine the mucosal immune response and tolerance. Tolerance meaning tolerance to diseases, of course, and to unwanted immune responses. And so breastfed newborns have been demonstrated to carry a more stable and uniform population when compared to formula-fed, a more stable here. And then, okay, you can see here, I hope the picture is clear, but there are several bioactives of the breast milk itself, which we will talk later on. Okay, this is just some nutritional information like macronutrients, minerals, fat-soluble vitamins, water-soluble vitamins that you can find in the breast milk. So the breast milk itself is enriched with all these nutrients. And again, more on macronutrients here and micronutrient as well. We won't be talking much into this, and you can screenshot if you want. And I will give also the resources at the end of this. I will show you some resources that are beneficial, and this is some macronutrients as well. Okay, if you can see here, this is very important, which will be the focus of our talk today, the bioactive components, which is the HMO. HMO is the human milk oligosaccharides. Okay, it promotes the gut barrier function. This is only found in breast milk. It's not found in formula milk, although some researchers have tried to like supplement the formula milk with the HMO, but the effect, the impact on the baby is very much different. And so I would say that probably is irreplaceable. The HMO is very, very important, especially for the immune response, immune system. We will learn more as we go forward. It promotes the gut barrier function, and it's a valuable approach to build up the gut barrier and perhaps restore, strengthen its function in conditions associated with occurrence of leaky gut in humans. You may have heard of this leaky gut. Yes, leaky gut is real, and it's not some conspiracy theory. It is real, and it is the fact that the gut microbiome is being researched nowadays proves that yes, the leaky gut syndrome is real. Okay, here, okay. It also the HMO also promotes healthy microbiota with anti-inflammatory properties and prevent or decrease the pro-inflammatory ones. Okay, the HMO, it is the third most abundant solid component after the lactose and lipids, and structurally and biologically diverse group of complex indigestible sugars. It is also known to support the growth of beneficial microorganisms, which is the bifidobacterium. I'm going to mention a lot more about the bifidobacterium here. And HMO can prevent infection because it acts as soluble decoy receptors, and with HMO, it can let the pathogens that attack the gut microbiome to pass harmlessly through the gastrointestinal tract. And why? It also decreases the adhesion of, or invasion of pathogens. It inhibits the growth of pathogens and thereby reduce their infection. It also provides not just the, for specifically what kind of pathogen you might be wondering. Yes, viral, protozoan, bacterial. So not just bacterial, viral, even parasite infections. HMO is known to have significant role as well. Okay, this is just another picture to show how the early life microbiota is being affected by the breastfeeding. And okay, another picture here. Okay, you can see here the breast milk. By feeding the breast milk, which contains the HMO, again, you would promote microbiome diversity, and then you will give an equivalent microbiome, a stable microbiome throughout the infancy years. And then by the time you introduce solid food to your children, the microbiome diversity will actually go higher. When you were giving breast milk, solely breast milk, exclusive breastfeeding, it doesn't mean that you have lower diversity, which is not good. No, it means you have equivalent microbiome. And then when you start introducing solid food, like complementary foods, the diversity is actually increased, which is good. And so we will talk more about this also later on. Okay, the breast milk, studies have shown that whether you're receiving exclusive or partial, you will still be able to benefit from the breast milk itself, because it is higher in, again, bifidobacterium species. Also, what does this bifidobacterium species does? And it's very important, so I want you to take note of this. So for infants whose gut microbiome are colonized by the bifidobacterium species, they usually have more robust vaccine responses. We know that vaccine is important for our children, and it reduces the incidence of autoimmune disease. Take note of this. Having the bifidobacterium, a stable or high level of bifidobacterium during the infancy age, can reduce the incidence of autoimmune diseases. And then also, what is the opposite then? If you don't have enough bifidobacteria. So if you don't have enough bifidobacteria, many children can have inefficient digestion, and it can also lead to, studies have shown that it can also lead to incidence of digestive issues like irritable bowel syndrome, irritable bowel diseases. And also take note here that for women who are overweight when they are pregnant, that also contribute to lower concentration of bifidobacteria. So you see here, we know that there are many factors affecting the infant gut microbiome before the birth itself. And knowing that there are so many factors that we might not be able to control, how much useful it is for us to utilize this breast milk in order to increase or improve the level of bifidobacteria for our babies. And again, the key players in the NEDIC guide are the bifidobacteria. This is being emphasized again, and which it dominates the microbial community of human milk fed infants. And breast milk gives a flora rich in bifidobacterium, and if you do exclusive breastfeeding for 6 months, then you have that microbiome that is rich in your stool. When it's being analyzed, it's rich in bifidobacterium and lactobacillus, which is what we want. And later in life, breastfeeding has also been associated with reduced risk of inflammatory bowel disease, cardiovascular disease, obesity, and type 2 diabetes. We will talk more about this afterward. And just a brief intervention here. Why not formula milk? Formula-fed infants are more at risk for early introduction of solids. And if you introduce solid foods prior to 4 months, it is even associated with increased weight gain and adiposity. So this is not what we want. So I'm talking about formula milk here, cow's milk, formula milk based on the cows or dairy. And so this is way in opposite with the breast milk itself. And in comparison, formula milk infants, they lack this species of bifidobacterium, which is abundant in the breast milk fed infants. Now, I mentioned last time that we're going to talk about gut-brain axis. Although we won't be talking too much details, I just wanted to know that throughout the lactation period, throughout the period of breastfeeding, lactation period again, the breast milk has significant contribution in positively altering the structures and functions of the gut-brain axis early in life. It matters to the spatial learning and memory formation. It matters to cognition, arousal, attention, and memory. It matters to behavioral alteration and depressive and anxiety behavior. And so the breast milk bioactives prime the immune system of the infant, which is the bioactives here we're talking about is the HMO, which is related to the bifidobacterium. And with the breast milk, intestinal barrier also tightens because it interacts with the microbiota itself. And by the time your baby is ready to be introduced with solid foods, at this period of time, why plant-based diet still matters? Because at this point in time, the neurons are highly plastic in response to diet changes. When we mention plasticity here, plastic, it means the ability to adapt to changes, the ability to learn new information. It's pretty much neuroplasticity here. And also at this time, odor and taste preferences is established when you introduce solid foods. So it matters the kind of diet that you introduce to your babies. And then the time of introduction of solid food also determines the immune response. So the timing also matters. Again, if you have formula-fed infants, you are at risk of introducing too early of the solid foods. And then breast milk itself and the plant-based diet increase the microbiota diversity and richness. And so what if you have a negative alteration in the microbiome? Then studies have shown that this biosis stage state is correlated with behaviors associated with autism spectrum disorder, and not just ASD. There's a lot more infections and all. So the gut-brain axis, the gut microbiota is involved in brain health throughout the lifespan, starting with early postnatal neurodevelopment through the aging. And so when there are deficiencies in early programming, those adults could be more vulnerable to diseases. So I think this matters. I'm actually, in a way, I'm glad Chelsea asked me to talk about the infancy and the toddler, the early life, and also the extreme, the late life, the elderly stage, because we know that what you do when you were an infant is significant to what happens when you're already an elderly. And brain growth and development during the first 3 years of life occur in parallel with the development of the gut microbiome. So again, the gut-brain axis that we're talking about here. And these early gut-brain effects on CNS, this central nervous system, may set the stage for later neurological or neuropsychiatric disease. Does it have something to do with the development of Alzheimer's disease, dementia? Studies are looking into that, and we might not be able to draw a fixed line, but studies are looking into that. And we will know more as there are more studies we see. So again, this is just a picture of how gut-brain axis matters for the neurodevelopment. Formula breastfed makes a difference. Whether you're born vaginal and cesarean section, it makes a difference. What kind of diet you have here, the maternal diet, and everything here, and introduction of complementary foods, it matters to the development of brain and the behavior of your child. Now we're talking about critical developmental period here. What is this critical developmental period? It is this time, the early age, the 6 months, the infancy, which is 1 year, and also the first 3 years of life. It matters. So these sensitive time periods are temporal windows of developmental opportunity that, if missed, alterations in growth and normal functions of body systems are irreversible. If missed, okay? And to what extent is it irreversible, or in what ways is it reversible? Studies are looking into it, but we know that it's not something that we want our children to have. And these periods, preconception, pregnancy, peri, and early postnatal life, are characterized by rapid changes in maturation and neuronal, immune, and endocrinal and metabolic processes. And so I mentioned earlier, quantity and quality matters. Yes, because this is a sensitive period. It is crucial indicators of weight gain and metabolic regulation, as well as CNS development, microbial composition, and immune system priming across lifespan. Say, what I'm talking about here is when we don't train our child to, let's say, learn temperance, to learn having a good eating behavior as early as when they're a child, then they're likely to develop unhealthy eating behavior as they grow older. And you know that as a tree that is growing up, when you're already growing up older, the harder it is to make behavioral changes. But is it impossible? No, it's not possible, but it is harder, and it's very likely that you might not be aware of it until certain diseases have manifest, so that's why we don't want that. And just to give you an overview, this is some composition, nutritional components of the breast milk across life stages of lactation. In the first 1 to 5 days, why is it important? Because the breast milk is very rich in immunoglobulins, lactoferrin, leukocytes, vitamins A and E, growth factors, and protein, low quantities of lactose. So this is good for immune system development. Yes, the first 5 days, and then first 2 weeks, transitional milk. Your breast milk is considered transitional milk because it's richer in lactose and fat compared to the colostrum and proteins as well. And when you're 4 weeks and into the end of lactation, richer also in lactose and water, and richer in vitamin B1 and B6, which is very, very important. And so the nutritional needs of the baby is being met throughout this period of time. Now, there are short-term and long-term benefits of breast milk, and we'll talk quickly into this. Breast milk is known to significantly lower the risk of respiratory infections, otitis media, with significant reduction in morbidity, hospital administrations, and also mortality. And it also shows reduction in risk for pneumonia, and it protects. One of the most significant risk factors is significant thing for the breast milk. It protects against diarrhea. And also, studies have shown that it reduces the incidence of atopic dermatitis or eczema in breast infants. These are short-term benefits. And what are the long-term benefits? This is what we really want to know. As I mentioned earlier, there is significant decrease in obesity. And again, this period of time, giving your baby breast milk, it gives them early opportunities for flavor learning. And also it's affected by the flavor of the mother's diet as well. But what matters is the infant is being taught to modulate the later food preferences. And it favors the establishment of diverse microbial communities. So take note here, early opportunities for flavor learning. When you start it early, when you start feeding your children healthy food, healthy plant-based diet, your children will develop healthy eating habits. They develop healthy taste, healthy preferences. They will prefer foods that are more healthy or more plant-based, and so they won't be having difficulty in abstaining from junk foods and so on. So this is significant. So breast milk also contains long-chain polyunsaturated fatty acid. It's associated with reduction in blood pressure, induce early changes in skeletal muscle, which can be protective against insulin resistance and type 2 diabetes. And also, again, gut brain axis. There's a positive correlation between breastfeeding and the levels of intelligence and cognitive development of children. And with children who are breastfed longer than 6 months have better cognitive outcomes and lower risk to develop ADHD, attention deficit hyperactivity disorder. And also children who are breastfed longer have significantly decreased risk of getting autism. So you can see here that the benefits of breast milk feeding is far-reaching. The duration is also correlated negatively with antisocial conduct and aggressive behavior in children aged 4 to 11 years. Wow, isn't that very important? Isn't that how sometimes probably some mothers would think that, how I wish I had fed my children with breast milk, how I wish, and you might be able to recall why some children are having more aggressive behavior or more antisocial in this age. So it tells us something definitely. Now, aside from the benefits for the infant itself, for the child, there are also benefits for the mother, like reduced breast and ovarian cancer risk if you are lactating, if you are giving the breast milk, and you have reduced hypertension and type 2 diabetes yourself, and it gives you a better psychological well-being. Now, what are the alternatives for mothers who are not able to give breast milk because of certain absolute contraindications to breastfeeding? There are alternatives, yes. Organic, non-GMO soy-based formula. We talk about formula. Soy formula is not the same as soy milk that we adults drink, of course. But take note that soy formulas are safe for full-term infants, but not for premature babies. So everything, again, I would encourage you to have all these consult with your pediatrician. So, okay, next. Okay, now earlier we mentioned about vitamin D, remember? And so why vitamin D matters? Full-term healthy babies, they receive. Okay, this is for irons, not for vitamin D. I'm sorry for this slide. I just want to talk about vitamin D. Why vitamin D matters? A few days old after birth, you might be asking, why can't I just give my baby's sun? Because sun gives you, it helps your body to absorb vitamin D. But for infants specifically, actually, it's been well known, established already that as much as possible, infants should, the use of deliberate sun exposure to maintain vitamin D sufficiency is not recommended. And infants younger than 6 months should be kept out of direct sunlight as much as possible. For some mothers, this might be shocking, but we're talking about infants here. And Why is that? Because the amount of UV exposure available for the synthesis of vitamin D depends on many factors, not just the time you spend outdoors, like the amount of skin pigmentation, the body mass, the increase of latitude, climate change, season, the amount of cloud cover, the extent of air pollution, amount of skin exposed, the extent of UV protection, and so on. And then the most important thing, scientists and doctors have studied that the most important of which is the degree of skin pigmentation, which makes it difficult to determine what is adequate essential exposure for any given infant or child. Now, fortunately, I think this talks more about Caucasians or white skin, inferior to those of black skin, or for us maybe brown skin. But science have shown also that indirect epidemiologic evidence now suggests that the age at which direct sunlight exposure is initiated, which means begun, is even more important than the total sunlight exposure over a lifetime in determining risk of skin cancer. So that is why it matters. And so that's why the American Academy of Pediatrics recommends that as much as possible for infants, supplement of vitamin D should be given, ideally to all children, but especially for infants. For children, when a child is able to receive vitamin D from fortified plant-based meals, that is okay. Some of them might not need to take vitamin D if they are able to achieve the recommended amount, the daily amount of vitamin D. So all these, why is it being recommended against the sunlight exposure? Because morbidity and mortality from UV exposure related to skin cancers are completely preventable, and this is what we want to avoid. So next, okay, this now is iron. Iron liquid supplement, 1 milligram per kilogram per day. Why? Beginning 4 months old until solid foods such as iron fortified cereals are introduced. Again, how about from the mother? Yes, the mother has enough iron if she's taking the supplement, but the full-term babies receive enough iron from their mothers basically in the 3rd trimester of pregnancy until the first 4 months of life. So after that, your baby still needs to take the iron liquid supplement until such time when iron fortified cereals or plant-based meals containing iron fortified foods are being introduced. That means later on in several months old, or probably after a year. So okay, so this is just a quick overview. From birth to 4 months, we talked about it already, the breast milk, vitamin D, iron. And for 4 to 6 months, you usually start complementary food. And okay, we'll talk about this complementary food. And for 6 months, you introduce finger foods. What is finger food? Some of you may know already. Foods that you chop like fingers. Okay. Some of you may ask, when can my child begin solid foods? So every child has different readiness and different pacing. So you need to ask yourself these questions. Can my child hold his head up? Does he open his mouth when food comes his way? Can he move from a spoon into his throat? And is he big enough already? So these questions are important because we want to prevent like choking. We want to prevent things like unstable head movement or head standing, head control. So for complementary foods, again, the most cautious approach is to offer a new single ingredient food one at a time. So every time you introduce the food, your goal is to see if there is any intolerance, if there is any hypersensitivity reaction with your child. And first foods, they need to be pureed and offered on a spoon. Pureed, what is that? We talk about more after this. Why is it pureed? Because you want to prevent choking. But take note that homemade purees or vegetables, purees or purees, some people call it like that. For vegetables are pureed, they are higher in nitrates like spinach, beets, squash, and carrots. It should not be given earlier than 3 months of age, since these vegetables can cause methemoglobinemia. So again, the AAP recommends that you expose your child to a wide variety of flavors and textures multiple times, and then sometimes your child may not be willing. They might reject the food that you give it to them. And then if they do that, an advice is don't give up, because consider offering the food 10 to 15 times until your child is willing to accept. Of course, gently, because especially when they see their peers eating the food, they're more likely to be willing to eat the food. And even research shows that it can take about 10 to 12 exposures before a child will accept new food. So take a break and offer that food again after a few days later if the child refuses. And important thing is familiarity leads to preference. So just keep offering with a smile. And around 9 months, your child is able to eat 3 meals a day, purees and some table food. And again, remember to cut it into small pieces to avoid choking hazards. And at this time, allow your child to learn how to use utensils. And if you haven't already, you can introduce water in a small cup. And at this time, it's very important because if you teach your child to eat at regular intervals, it will help your child to foster self-regulation and reduce overeating. And this is where the eating behavior starts early as infancy. Okay, this is just some dietary reference intakes. You may screenshot about this, but some of the resources I will give to you at the end of this. Okay, this is some book that I recommend if you want to know how a vegan diet can be introduced to your child. And if you still have any questions, is it safe? Yes, vegan diet is safe. Vegan diet is rich in whole food, plant-based. It's safe even for a child. No, your child will not suffer any nutritional deficiencies if you're doing it right. Take note, if you're doing it right. Okay, this is just some examples of what I mentioned earlier. Puree food, smooth, mashed, and then finger food. Finger food is what you call it. You cut it into small sizes, not too big, not too small, so that your child can still hold it with their fingers. So here, example. This is just some pictures to show you. And then remember to never add sugar or salt to food that are served on babies. Okay, this is just some other examples which you can find in the book. Okay, for finger foods, as babies learn to handle foods in their mouth, a wider range of finger food actually can be offered. They learn to bite and chew. Okay, the golden rule is to offer simple food that is not processed, so let the baby be involved in experience of eating. And you should to avoid ultra-processed foods because it's significantly correlated with increased risk for colon cancer. And then again, help your baby, encourage your baby to feed themselves with their fingers and then to use the utensils, spoon, and then help them to drink from the cup also, because they have innate ability to self-regulate their food. So you teach them to also recognize when they're hungry, when they're already full. Teach them that early on. And of course, there are barriers for parents like time and cleanliness. This is something that we should all, everyone, for the benefit of our children, we should all be patient and we should bear in mind. And okay, healthy drinks. If you haven't already, you can introduce water. Water is the best. If you want to introduce juice, wait until 6 to 9 months and limit to 4 to 6 ounces. And do not add sugar-sweetened beverages into your juices. And children who consume such fruit juices have higher energy intakes if you have pure fruit juice. Okay. And by 1 year, the baby, again, you can introduce regular cup of water, and the baby, a majority of the calories should come from solid food, and baby by this time should largely be eating like what the rest of the family eats with less modification. Milk intake is less than before. Now, for your children, some of you may be asking, I want to increase the protein intake of my children. I want to make sure that my children get enough protein. So what are some alternatives to plant-based nutrition if I'm already weaning, if I'm not, if I'm already not giving my child breast milk? Yes, there are alternatives. If you are weaning your infant at 1 year, consider using soy milk for its high, because it is higher in fat content and it has more complete nutrition. But if you or your child already consume soy products like tofu, tempeh, regularly, you can consider hemp milk instead. The other kinds of milk, plant-based milk, is not very much considered, like rice milk here is not considered because it is high in arsenic level and low nutritional value. But if you're trying to limit calories, you can consider almond milk. It could be more appropriate. And coconut milk is not recommended because it is high in saturated fat. So, okay, this is just a comparison between the type of nutritional plant-based milk. And if you can see here, whole cow's milk, 50 ml, this is the equivalent amount. It's soy milk, coconut milk, almond milk, oat milk. Okay, this is just nutritional values. It can be found in the book. And so for toddlers, how about for toddlers? So for toddlers, we want to make sure that they grow well. Back then, some people are concerned, what if they consume less calorie? What if they weigh less? Because they are concerned when looking at the growth chart from WHO. But thankfully, they're concerned because when they compare, it doesn't seem to be in sync with the growth chart of the WHO. That is because there are different kinds of growth chart for breastfed and formula-fed infants. But thankfully, by 2006, the WHO has already adjusted their growth chart, making a standard which is applicable for both breastfed and formula-fed infants, so we don't have to worry about that. And by this chart, we can tell that, yes, the growth is going well for children who are being fed with plant-based nutrition. And in toddler years, your child should have similar meal content as adults, and by diversifying, you will give them more opportunity to know more about plant-based nutrition. And remember that make sure that they get enough calories, because from time to time you need to consult with the pediatrician to make sure that, is my child having enough calories, is it growing well? Refer to the growth chart, and don't forget regular visit to pediatrician. Okay, these are some ingredients to avoid. This can be found in the book that I mentioned earlier, and this is again just some comparison. Recommended servings for plant-based kids by this age. This is also found in the plant-based book that I mentioned. And okay, we should also be aware of daily calcium requirements throughout different ages. And later I will mention what are some sources of calcium in plant-based foods. And here you can see some of them here. These things are widely available. That's why at the end I'm going to give you all the resources so that you can download or you can have for yourself and take note, because we don't have the time to discuss one by one. Okay, vitamin D, it matters. Children less than 1 year should minimize direct sun exposure again, because they have more sensitive skin, and they should also supplement. Fatty foods like avocados and nuts can help increase vitamin D absorption by up to 40%, and vitamin D only stays in our bloodstream for 24 to 48 hours, so that's why we need to supplement daily. What else? This is omega-3. There are doses. Take note. Make sure the quantity is sufficient. Quantity is as important as quality. If we know only the quality but not getting enough in the quantity, then we might be losing without realizing it. Okay, this is for iron. Why again iron supplement is important, but iron supplement is not for lifetime. Remember again, unless you have specific deficiency. We're talking here about early life iron supplement. And of course, again, when you start iron supplementing with iron at the age of 4 months, after the time when your baby is able to consume foods that are fortified with iron, then you can probably stop giving your child iron supplements already. Okay. This is plant-based iron sources. You can see here, it's also in the book. And comparison of proteins okay. The key here is for your child is to include a array of fiber-filled, nutrient-dense, antioxidant-rich, whole plant-based foods at every meal. You can use herbs and spices as flavor and enhancer. Don't use the MSG or whatever. It's all in the past. I mean, we should elevate our standard. No, we don't want to use MSG anymore. We're far above that, and we know that it is something that it is the least that we want to give to our children. If you